Baby, baby. Greg, she's not breathing. Activate emergency response.
Got it.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Any emergency can seem scarier when an infant is involved. However, the principles of performing CPR on infants less than a year old are the same as they are for adults and older children, with a few significant differences. To begin, let's take things in the same order as we did for adult CPR. We're going to teach you the skills you will need for 1- and 2-person infant rescue. First, check the victim for a response and breathing. If the infant is unresponsive and not breathing or only gasping, send someone to activate the emergency response system and get the AED. Check the infant's brachial pulse. Place 2 or 3 fingers on the inside of the upper arm, between the infant's elbow and shoulder. Press the index and middle fingers gently on the inside of the upper arm for at least 5 seconds and no more than 10 seconds when attempting to feel the pulse. If there is no pulse, or if the heart rate is less than 60 per minute with signs of poor perfusion, make sure the infant has adequate oxygenation and ventilation. If he or she does, begin CPR. Place the tips of your 2 fingers in the center of the infant's chest, just below the nipple line. Do not press on the bottom of the breastbone. Push hard and fast, to a depth of at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters, at a rate of at least 100 compressions per minute. After each compression, completely release the pressure on the breastbone and chest, allowing the chest to recoil completely. Count out loud as you give compressions. Give 30 compressions in a row.
26, 27, 28, 29, 30.
Let's look at a couple of key differences when you are performing 2 rescuer versus 1 rescuer CPR on an infant. One is a different hand placement. When you do 2 rescuer CPR, the compressor will place both thumbs side by side in the center of the infant's chest on the lower half of the breastbone. Do not press on the tip of the breastbone. The thumbs may overlap in very small infants.
1, 2.
The other key difference is in the compression to breath ratio. With 2 rescuers, for the child or the infant, you will use a ratio of 15 compressions to 2 breaths. Now let's review the entire sequence of BLS for an infant. Just watch now. You'll have a chance to practice momentarily. First, check for responsiveness and breathing. If the infant doesn't respond and is not breathing or only gasping, shout for help. If you're alone, begin the steps of BLS. If others are present, send them to activate the emergency response system and get the AED while you remain with the victim to check the pulse and begin the steps of BLS. Check the infant's brachial pulse by gently pressing 2 or 3 fingers on the inside of the upper arm, between the elbow and the shoulder. Do this for at least 5 seconds, but no more than 10 seconds. Begin compressions at a ratio of 30 compressions and 2 breaths.
9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
The defibrillator and code.
When a second rescuer arrives, you switch to a ratio of 15 compressions and 2 breaths.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
One other note. Rescuers switch roles after every 10 cycles of CPR to prevent fatigue.
9,